Hi everyone, welcome back to my channel. My name is Caroline. If you're new here, subscribe, give me that like, share. And on this awesome episode, I have with me Dr. Dawn. Yeah, so welcome Dr. Dawn.
Thank you.
Maybe you can tell the viewers what you do, an introduction.
Okay, my name is Dr. Dan. I'm a general practitioner. I am very enthusiastic about women health. Okay, I also run a channel. I really run a channel where I usually educate women about their health and stuff.
And that's why he's here, guys. So women out there, I have you covered. Men, everyone, he is the best when it comes to health. He deals with everything that concerns us, and that's why he is here, and it's just amazing to have you. So welcome. Yeah, so guys, let's get started. I am so excited for Dr. Dawn. But before we get started, everything involving health, maybe you can have a nice breakup for you.
Okay.
Which was your first cell phone that you had? Your first cell phone?
I had a Nokia. I think it used to be called Nokia 310. That small tiny Nokia, yeah.
Okay, nice. So if you were like, right now you have a smartphone, right?
Yeah.
So if you were to delete 3 apps or to keep 3 apps, which apps would you like to keep on your phone?
Well, I would like to keep my YouTube app, of course.
Yeah.
Then I would like to keep, of course, my WhatsApp, and I do a lot of Twitter. So yeah.
Twitter.
Yeah.
That's interesting. But this is a hard one. If you were only to have a phone or a car for the rest of your life, which one would you choose?
I think I'd have a phone.
More than a car, like your phone over a car.
Yeah, because I can communicate with everyone. I can't communicate with a car, so yeah.
That is interesting.
Yeah.
So I really would love to know something about your religion. You're a doctor, so if you can tell us something about your religion.
Yeah, I'm born again Christian.
Okay.
Yeah, you love God. Yeah.
That's it.
Yeah.
Something else?
What to tell you?
What made you like believe in God?
I grew up in a Christian family.
Family. Oh.
Yeah, so it was quite natural for me, Yeah, it was just quite natural for me to just grow up, know the way and stuff. Yeah, so I just kept on moving forward. Yeah,
Basically.
Yeah.
And with God, all things are possible.
Definitely.
So we'll get started. I think that's enough icebreaker for you.
Yeah, sure.
You ready to give us tips on health?
Yeah, anytime.
Anytime. Okay. So here we are. We're gonna make a simple meal.
Okay.
Chicken pasta. So what we need for ingredients: some broccoli, and you just boil your penne pasta. It looks like this. Some grated cheese. Your chicken, you just boil it for 15 minutes and then you cut it into strips. Some onions, some red bell peppers, of course some parsley, and then you'll need 2 tablespoons of butter, 2 tablespoons of oil, and some carrots. And then that's it. And then for seasoning, of course, I always love salt, black pepper, and garlic. And then that's it. You have your meal. So tasty. This is the best meal you'll ever have. Are you ready?
Very much ready. I can't wait.
Yeah, you can't wait.
Yeah.
So first of all, you're gonna heat your oil.
Okay.
Can you just heat your oil on a medium heat? So first of all, you put your oil.
Okay.
Yeah. All of it. And then you put in your onions. And I'm curious to know your second.
My second name is difficult for most people.
Yeah, what is that?
Sechiwunga.
Sechiwunga.
Yeah, it's very difficult.
What's your national? Ugandan. That's amazing. What are you doing in Kenya?
I'm a practicing doctor.
In Kenya.
Yes.
So something else that I'm really concerned about is high blood pressure. Like, I want to know what causes the high blood pressure.
Okay, now blood pressure, usually it can be familial or it can be acquired. Some people tend to, you've seen families where they say this family they have high blood pressure.
Yeah,
so you can have that
so
type.
common. Yeah.
You can have that type of high blood pressure. Usually there's really no cause attached to it.
Okay.
Then you can have high blood pressure following a particular maybe disease or occurrence in the body. Say for example, someone has kidney disease. So when you have kidney disease, you get high blood pressure. Or you have goiter, thyroid disease. So you may end up having high blood pressure. Or because of poor diet.
It also causes that.
Yeah.
Okay.
You eat a lot of salt, chumvi, so you can still get high blood pressure. That's acquired.
Acquired.
Yeah.
Okay. So at this point, after 2 minutes, and that turn it, just put your chicken. How is it smelling? The aroma.
Very good. I can't wait to
You can put
taste
all of it actually. Like that. So simple. So when you have guests incoming, it's so easy to make. So something else about high blood pressure, like are there other health problems associated with the high blood pressure?
Yes. High blood pressure tends to cause heart disease.
Okay.
So so you find someone who has had poorly controlled high blood pressure, they've eventually developed heart disease or what we call heart failure. Or you've seen people with stroke because they have had high blood pressure. I'm actually a victim. My grandmother had high blood pressure and he eventually got stroke. So I speak out of experience.
Out of experience.
And of course out of the many people I've treated.
Oh, okay. So that's about that. So like how is it treated, the high blood pressure? Is it treatable?
Yeah, high blood pressure.
And how does someone know they have high blood pressure, or how can they, like, is it preventive?
Yeah, so how you can know that you have high blood pressure, usually you get symptoms, sometimes headache, sometimes you're very fast, sometimes you're feeling unease. Then as you walk into the hospital, you take your blood pressure, then you find they're high.
They're high.
Now there are levels. Not every high blood pressure will give drugs.
Okay.
Now there are some, for example, there's what we call pre-high blood pressure. Okay. When you have pre means before. So once you are at the risk of both high blood pressure, we tell you to do exercise, to reduce salt intake, to avoid fatty foods, and to reduce body weight. Okay. Yeah. So those are the lifestyle
changes.
So once you do that, the blood pressure can actually be medication. Yeah, but if the pressure is very high, to a certain extent, we may actually start with medication. Okay.
Wow, this looks amazing, guys. So you are a good cook.
Thank you.
It smells actually nice. I'm curious to know which kind of music do you listen to? Tough one.
I listen to most music, honestly. But I think I listen to Christian music.
Okay.
I listen to reggae.
Oh, reggae.
Yeah.
Okay. So what are these two things that you're really good at? Two things. As you add your carrots, you see there, it's so simple.
Yeah, it's coming out very good.
And then you add your broccoli. There. Do you like broccoli?
Yeah.
Because it's so healthy. It's so healthy. So you just mix, and then so that it doesn't stick, put a bit of our butter so it doesn't stick on the pan. Yeah, so two things you're good at, or two things you're bad at.
Let me do what I'm good at.
Okay.
Yeah, I'm good at listening.
Okay, that's nice.
And of course, one, I can, as a person, I'm good at listening.
Okay.
And second, it's also part of my job. I do a lot of listening in my job. So.
Okay. So I really wanted us to talk about arthritis. Yeah. What brings about arthritis? What is rheumatoid actually arthritis? Yeah. Because I know it's a really chronic condition that is, you know, I see inflammation in joints in people. Yeah.
Yeah. So arthritis just means, like you said, inflammation.
Okay.
Like the bones are like eaten up. Yeah. So rheumatoid arthritis in specific, usually it's a familial disease.
Okay.
Like you find if the father has it or the mother has it, more likely the sons or daughters may have it.
Okay.
So usually it is uncommon for you to just have it out of the blue.
Okay.
And usually it appears at a younger age than other types of arthritis.
Okay.
The most commonest arthritis usually is age-induced arthritis that usually is we see in the older people.
The older people.
The golden generation.
Yeah, it really affects them.
Yeah, usually it comes with age. Then of course we have other things. It is because of trauma. Say for example, you've had an accident in a particular joint.
Oh, and then
eventually develop arthritis.
Okay, you can put a bit of salt. And there are other types of arthritis. And then you're gonna put a bit of black pepper. And then a bit of the garlic.
Yes, it's the types of arthritis.
Okay.
Like you've given a very good example of rheumatoid arthritis.
And how can someone know the type they have?
Usually you get to know the type. For example, there's certain tests we do for you to know. But again, even symptoms. For example, there's a particular way the bones of rheumatoid arthritis will appear. There's also what we call gout arthritis. Have you heard about gout?
Yeah, I have heard about gout.
So even the way when I look at the joint of the gout, of the gout patient and the joint of rheumatoid arthritis patient, I can know how it looks like. Yeah. Or when someone comes age 70 complaining of back pain or knee pains.
Knee pain. Mostly the knee pain.
Yeah. Or so there you know most likely it's senile arthritis. It's kind of because of age.
Because of age.
Yes.
Oh, okay. And are there any other like warning signs of arthritis?
Yeah, usually you get onset pain.
Onset pains in the joint. Maybe you can add this. This is the red bell pepper. Yeah. Just so healthy. You can put all of them. Healthy diet.
As you said. Healthy
made. Yeah, you're really good at this. Just really amazing.
Really good.
Really good. Look at this. That's the people see.
It's really cute. Cut us off, Dr. Dan.
I am excited to see what you've made. Tasty, actually. Yeah, so we will plate it. You will love this. It looks amazing. I'm excited to know, as in, when do you want to retire?
At 40.
At 40?
I'm not joking.
Yeah. Okay.
Yeah.
That's nice. Why is that?
I don't want to be at 60, hustling with with issues to do with work. Yeah.
So you want to be having your own place, retired by then.
Yeah.
Okay. There you go. How does this look?
It looks amazing. Wow. It's also very nice. Very nice. This chicken is the best.
And broccoli. I love it. You can feel the butter, the cheese. Amazing, and so healthy.
Very.
So people out there don't have to use food that is not healthy.
Yeah.
It can be tasty and yet healthy. Yeah, even for your
100%.
kids. So before we wind up, I would love to ask you one more question. How did you spend your first paycheck?
I spent the whole of it.
What did you buy?
I can't remember.
It was exciting.
Yeah, I can't remember honestly. To be honest with you, I can't remember. I just spent it. Okay, I sent a few to my family, back home, yeah, but I can't remember.
I can't remember. For some of us, the first paycheck, I remember photos. I still even have that photo with me. I received so much money, I was like, this is mine. And then you look back on it and you just laugh.
Yeah,
It
sure.
was not like a smudge. So anyway, it was awesome having you, Dr. Dan.
It was a pleasure.
Maybe, yeah, you can tell us some of these other surgeries you do in the hospital, because I understand like most women, like pregnant women, they are afraid, do I have CS, will I have no more pregnancy, like they just normally have that fear. If it's normal, how many days will I spend in the hospital, how is the CS, like they always have that in their mind.
So at the hospital, I do both minor and major surgeries.
Okay.
Minors are these regular day outpatient procedures, starting with excisions of small swellings,
Okay.
specifically for ladies, things like evacuation.
Okay.
Evacuation, for example, someone has had a miscarriage.
Okay.
We usually call it coercion, so that one. Then cesarean sections, yeah. I do them on a regular basis. At least every day, I usually do at least one, you know.
At least once, yes.
Yeah.
Okay.
So then I do laparotomies. Laparotomy means opening up the entire abdomen and inspect what is the problem. Sometimes, for example, for women, you want to do something, you find the woman is bleeding. Maybe the baby is in the tubes and you want to check and find out probably where it's coming from. And yeah, I do such. So yeah, it's better.
So like for pregnant woman who is really worried about the procedure, maybe you can tell them, is it painful?
No, actually, for pregnant women out there, cesarean section is actually not painful.
Okay.
Because first we give you an injection to make sure you don't feel any pain. Usually the injection is given at the back.
Okay.
So you find that you are numbed from half
Oh,
down.
half and
Yeah.
up you are aware.
You're aware. So
Oh.
you can tell us the sex of your baby. Yeah. So it's not painful at all. Like after the delivery, you walk within about 4 hours. We give you after surgery, we give you medications to make sure you don't have the pain. Yeah.
So they shouldn't be afraid to have these surgeries.
No, they should.
Because most of them like have depression even thinking about it.
Yeah. I know most ladies are actually more worried about pushing the baby than actually the surgery.
But for normal, maybe you can tell them how it is.
Yeah, for normal it's just of course yes, there's some pain. You know,
Some pain,
as,
of course.
As you're cramping, there's contractions. And delivery is the best.
The best.
Yeah, because recovery time is shorter.
Yeah.
And the pain after actually giving birth, the pain goes immediately. Plus, there are also measures of late where you can be given what you call an epidural, and you find you don't get any pain.
Any pain whatsoever. So what they do, just visit your doctor. Don't be afraid to ask questions. They are always available for us. They're just amazing people out there, and I'm so happy to have hosted you in my show. See, I've been an amazing host, was I?
Yeah, very. And this juice is very sweet. The chicken was wow.
Was wow. Yeah, you look to his YouTube channel. See Doc Health, subscribe, share, and like, and do so for me too. So that is bye.
Bye.